On TV1 every Monday to Friday from 4 to 5 p.m. with me, your host, Kaites Elizabeth. Now we bring you the latest transpiring health news globally and locally here in Uganda. We believe that being informed is the first step for making better health decisions. That's why we start with the latest news updates, and then after we go into the health expert discussion where you learn something that is going to help you live a better life. Now, to begin with, let's start with our top stories. Has postponed Uganda Matters Day celebrations over the Ebola threats. President Yoweri Museveni has postponed the year's Uganda Matters Day celebrations over fears of the possible Ebola outbreak linked to the cross-border movement from the Eastern Democratic Republic of Congo. Now, this decision follows consultations between the government, health experts, and also the religious leaders, and a growing concern about the risk of Ebola treatment during one of Africa's largest religious gatherings. In the statement addressed to Ugandans and youths, Museveni said protecting lives must come first despite the significance of the annual June 3rd pilgrimage held at Namugongo shrines in Kampala. The president of Uganda explained that Uganda receives thousands of pilgrimages every year from countries including Democratic Republic of Congo, where Ebola cases have recently been reported. He warned that the massive movement and the gatherings of the pilgrimages could increase the risk of spreading the deadly virus if precautionary measures are not taken early. Museveni also appealed to the pilgrims who have already begun traveling to suspend their journey and return home while continuing to observe the public health guidelines and reporting suspected illnesses to the health authorities. Uganda Matters Day commences at the 45 Christian converts who were executed in 1885 and 1887 under the Kabaka Mwanga II after refusing to renounce their faith. Now, the annual celebrations at Namugongo Catholic Shrine and Namugongo Anglican Shrine normally attract more than 2 million pilgrims from across East and Central Africa. Health experts say that Uganda remains vulnerable to Ebola imposition because of its porous border with Eastern DRC, which has experienced repeated outbreaks over the years. Authorities note that Ebola spreads through direct contact with infected bodily fluids and can spread rapidly in crowded environments where sanitation and health systems are strained. Government officials say that new dates for the Matters Day celebrations will be announced once the regional health situation is considered safe for all Ugandans and other pilgrims. And moving on to our next story. The government of Uganda assures that public Ebola situation is now under control. Government has assured Ugandans and the international community at large that the current Ebola situation remains fully under control following the confirmation of a case involving Congolese individual who entered Uganda from the Democratic Republic of Congo. According to authorities, the patient crossed into Uganda from the Eastern DRC and later died at the hospital in Kampala on Thursday after testing positive for this virus. Government says that the body was safely returned to DRC the same day in line with public health and cross-border disease control protocols. In a statement issued by the Uganda Media Center, Executive Director Alan Kasuja said that the Ministry of Health has already traced all individuals who came in contact with the patient, including the health workers, relatives, and friends. Authorities say that surveillance and monitoring measures are ongoing, but emphasize that there is currently no case or cause for the public to panic. The situation has been contained, government said, while encouraging the public to remain vigilant and continue observing the preventative measures at large. Ugandans have been advised to report anyone showing the Ebola symptoms such as a sudden fever, fatigue, chest pain, vomiting, diarrhea, unexplained bleeding or yellowing of the eyes to the nearest health facility immediately. Health officials also urge the public to maintain regular hand washing, direct contact with bodily fluids, and cooperate with health surveillance teams. Uganda has previously been praised internationally for successfully containing the severe Ebola outbreaks through rapid response team, contacting tracing and isolation methods, and collaborating with the World Health Organization. Officials said that the country's experience in managing viral outbreaks has strengthened national preparedness and response capacity against the future epidemics and the pandemics at large. Now, moving on to our next story. The IRC launches emergency response as a rare Ebola strain spreads in DRC and Uganda. The International Rescue Committee has launched an emergency response following a rapidly escalating Ebola outbreak in the Eastern Democratic Republic of Congo and the neighboring country Uganda. According to the health authorities in DRC, at least 88 people have reportedly died, while more than 336 suspected Ebola cases have been infected, building fears of a wider regional transmission. Uganda has also confirmed an Ebola-related infection linked to cross-border movement from Eastern Congo, increasing concern among the public health experts over the spread of the virus in the region. Primarily, laboratory analysis indicates that the outbreaks involves the rare strain from Bundibugyo of Ebola, a strain for which there is currently no licensed vaccine or approved targeted treatment. The outbreak has already been declared as a public health emergency of international concern by the World Health Organization. The IRC says insecurity, displacement, fragile health systems, and heavy movement of people across borders are making containment efforts more difficult, especially in conflicted affected Eastern DRC. Health reporters are particularly concerned about the city of Ngoma, a densely populated transport hub, where the virus could spread rapidly if the response measures are delayed. IRC Country Director Heather Carl warned that the Eastern Congo's prolonged conflict has severely weakened the healthcare systems, leaving communities highly vulnerable during the outbreaks. In the response, the organization says it is immediately rolling out emergency infection prevention and control measures, including the distribution of personal protective equipment to the frontline health workers. The response will also focus on the community engagement, self-isolation measures, strengthening surveillance systems, and supporting local health facilities managing the suspected Ebola cases. Humanitarian agencies are now calling for urgent international support and stronger regional coordination to prevent the further cross-border spread into the neighboring countries, including Uganda and South Sudan. Public health experts continue to emphasize that the rapid response, community cooperation, and strict infection control measures remain critical in stopping Ebola outbreaks before they escalate any further. Now, moving on to our next story. What is Bundibugyo virus disease? Health experts are raising awareness about Bundibugyo virus disease, a rare but deadly form of Ebola that has recently triggered concern in the Democratic Republic of Congo and Uganda. The disease is classified as zoonotic, meaning it is believed to originate from the animals, with fruit bats suspected to be a natural reservoir for the virus. Humans can become infected through direct contact with infected wildlife such as bats or non-human primates before the disease spreads from one person to another through contact with the bodily fluids, including blood, sweat, saliva, vomit, and other secretions. Health experts say that transmission is especially dangerous in healthcare settings where infection prevention measures are weak, as well as during unsafe burial practices involving the contact with infected bodies. The incubation period ranges from 2 to 21 days, and infected individuals usually become contagious only after the symptoms begin to appear. Early symptoms include as fever, fatigue, muscle pain, headache, sore throat, and signs that can easily be mistaken for illnesses such as malaria and typhoid, making early detection difficult without laboratory testing. So as the disease progresses, patients may develop vomiting, diarrhea, organ failure, and in some cases, severe internal and external bleeding. According to the past outbreaks reported in Uganda and the Democratic Republic of Congo, this disease has recorded fertility rates between 30 and 50% at large. Health authorities emphasize that there is currently no approved vaccine or specific treatment for the Bundibugyo strain, making rapid detection, isolation, contact tracing, and community awareness critical in controlling the outbreaks. The World Health Organization recently declared the ongoing outbreak in Uganda and DRC a public health emergency of international concern due to the fears of the regional spread. Experts warn that the cross-border movement, miming activities, and heavy population mobility in eastern Congo continue to increase the risk of the transmission into the neighboring countries, including Uganda and South Sudan. Uganda has previously managed severe Ebola outbreaks through aggressive surveillance, public health awareness campaigns, and rapid emergency response teams. So this calls for our people to be careful of this new Bundibugyo strain. So moving on to our global story, WHO urges action as 1.4 billion people live with high blood pressure. High blood pressure, also known as hypertension, continues to pose one of the world's biggest silent health threats, with the World Health Organization warning that nearly 1.4 billion people globally are currently living with this condition. So as the world marked the World Hypertension Day, WHO called for urgent action to promote healthier lifestyles and improve early detection, warning that many people remain unaware they have the condition until the serious complications develop. According to the WHO, hypertension is a major risk factor for the heart disease, stroke, kidney failure, and premature death. The organization says that the condition is often referred to as a silent killer because it may show symptoms for many years while quietly damaging the blood vessels and also the vital organs. WHO estimates that fewer than half of the adults living with hypertension know they have it, while many of those undiagnosed are either untreated or unable to control the condition effectively. Health experts say that the growing burden of hypertension is being driven by the unhealthy diets, excessive salt intake, alcohol consumption, smoking, physical inactivity, obesity, and increasing stress levels. WHO is encouraging people to adopt simply but effective lifestyle changes to reduce the risk of developing high blood pressure and the related complications. Among the key recommendations are maintaining a balanced diet rich in fruits, vegetables, reducing salt intake, exercising regularly, avoiding tobacco use, limiting alcohol consumption, and monitoring blood pressure routinely. WHO also emphasized the importance of regular screening because early detection can help prevent severe complications such as heart attacks, strokes, and many others. Medical experts warn that hypertension cases are rising steadily among young populations due to the changing lifestyles, urbanizations, early eating habits, and reduced physical activity. And also, the World Health Organization said that government must strengthen public health awareness, improve access to affordable medicines, and promote healthier food environments to reduce hypertension-related deaths globally. So as global attention focuses on cardiovascular health, the World Health Organization said that collective efforts from government, healthcare workers, communities, and individuals will be essential in reducing the growing burden of hypertension and saving millions of lives worldwide. Now, thank you for staying with us. Those are our stories for today. Now, we are going to move into a very important aspect of oral health that many people often associate only with appearance, but it goes much deeper than that. But before we head there, let's take a look at this video that shows one of a successful story of a person who had difficulties in their oral health, and then they, due to the improved technology, the person got better. So let's take a look at that video, and then we come back with more.
So I always felt like if it was a way of doing it without it, that's what I wanted to do. I wanted to let that be my last resort. I was speaking with friends and stuff, and they were like, well, yeah, you probably have to have the surgery. And I'm like, no, I don't want the surgery.
She found UIC online and again had the experiences with her children receiving treatment here, and was coming in expecting to hear the same thing that she had been hearing, and that surgery was the only option for her to improve her bite and her smile.
It made me feel comfortable because they came in with an open mind, not so much as the same thing everybody else said. No, we're not going to try anything. We're just going to do surgery. After the consultation, I felt okay.
She had a class 3 malocclusion with an anterior crossbite or an underbite. Some spacing on the lower. She also was missing some permanent teeth. So we knew from the beginning that it was going to be a collaborative effort with another specialty when it came to restoring and planning for what kinds of restorations would go into those edentulous or spaces. Her case was right at home in the ballpark of complexity of what we see and treat here at UIC.
They were able to get movement that actually kind of jumped my bite versus breaking my jaw to get the same effect.
Very commonly, we here in orthodontics will use a combination of modern technology and kind of tried and true methods, traditional methods and tools and appliances that we've used for generations in orthodontics. The technology and the minds that have a home here at UIC, kind of with all of those hands on deck, we really were able to formulate a treatment plan for Cheryl that did not include surgery. So just to give her that option, surgery was definitely still on the table, but it was really a good fit for her and just her personal wants for her case and her treatment to have an option that was outside of a surgical option.
It was like a breath of fresh air. And I felt like, okay, I'm at the right place. I didn't feel uneasy. What it cost me to do it was way better than what I was gonna spend before. So I just felt like I was in the right place.
The heart of a person's confidence really is shaped in some part, even a little part, by your smile. Where they can go with this new confidence and ease in themselves is limitless.
It made a big difference. I don't have to think before I smile. I don't have to catch myself and be like, oh my God, did I just show my teeth in a picture? Or something like that. So it made a difference. It gave me back the confidence I had before.
So we are back with our segment where we learn more about our health. and today we are discussing the importance of orthodontics in modern dental health. So when people hear the word orthodontics, they immediately think of braces and straight teeth, but orthodontics is not merely about improving appearance. It also plays a major role in the proper chewing, speech, jaw alignment, oral health, and overall dental health. So today we ask why orthodontic care is important, who needs it, and how can correcting dental alignment improve both health and confidence of ourselves. So to guide us through this discussion, we have been joined by a specialist, a dentist, and also a doctor who will help us understand the role of orthodontics in today's dental care and why it matters more than what people actually do realize. And this is none other than Dr. Rose Sendika-Diwa. You are most welcome, Doctor.
Thank you.
Thank you for coming. How was your weekend?
My weekend was restful. These days you must be very intentional about creating a restful Sabbath.
Yeah, of course.
Otherwise, the world is busy.
Yeah, so busy.
Yeah, the world is so busy. There's a lot of noise and a lot of distraction.
Yeah, sure.
Yeah.
And your journey coming here?
My journey coming here was okay. I was coming from Mod Kampala.
Okay.
And by God's grace, I didn't find a lot of jam on the road.
Yeah.
And I managed to be here on time. I really thank God that I was here in real time.
Okay, thank you very much. So without wasting any time, so let's just go straight in. What exactly is orthodontics?
Orthodontic treatment
Yes.
is a type of treatment under the dentistry care. Dentistry, of course, we are speaking dental care, anything to do with the mouth. Orthodontic treatment is a treatment that concerns itself with aligning the teeth properly in their line. Now the next question would be, who needs it and why is it important?
Yeah, sure.
Yeah. First we need to understand why sometimes the teeth are not as aligned as they ought to be.
Yeah, sure.
We have scenarios of small jaws which normally run in families that when the child is growing, the jaw has not expanded adequately enough to accommodate all the teeth.
Okay.
So the teeth that God gave you will forcefully find their room somehow to fit in the mouth, whichever way. And normally that kind of scenario you don't have control over it. You belong to that family where people have got small jaws.
Yeah.
And then eventually find yourself as a culprit. Another scenario where you can find yourself as a culprit, and sometimes it can be to a certain extent self-made, children who suck their thumb, specifically the thumb.
Okay.
Because this thumb can push your front tooth in front. And when they are still babies, people never pay much attention to it.
Care. It's just
but eventually, when the habit develops, the child can suck until a certain age.
Okay.
And then eventually you find yourself in a situation where you have an open bite. Open bite or overjet.
Okay.
Because the teeth naturally are supposed to slightly, the upper jaw slightly go over the lower jaw. But if you are some thaka or a person who suck their tongue, the upper teeth over project in front.
Okay, and they come out.
And they come out.
Okay.
Now the other situation, development abnormalities, normally which people don't have control over.
Yes.
Yeah, you find yourself that the jaws are aligned the way they are aligned, and the muscles of the cheek will always try to accommodate the status quo. Because you have to eat, you have to speak. So people who have got those kind of challenges normally will present with issues of chronic headaches or sometimes pain in the neck because the muscles are trying very much to align these teeth to be able to chew.
So on that same note, how is this orthodontics treatment different from that general dentistry? Like,
okay,
how different
what is general dentistry?
Okay, then maybe let's start from that. Exactly.
Let's start because by the way, start with, I'm a general dentist.
Okay.
But under general dentistry, we can also do orthodontic. But in this country, we have people who have actually majored on orthodontists.
Only that,
yeah.
okay.
Yeah. But many dentists can still do some to a certain degree.
Okay.
So dental care is to treat. When you first think about dental, your mind will take you straight to teeth.
Teeth, yes.
But we are saying these teeth don't stand alone. They have supportive structures, the gums and everything, the lips, the jaws and everything.
Okay.
So all the supportive structure in the mouth falls under dental care.
Okay.
And the major cause of dental problems, or oral, actually that's the best word,
Yeah,
oral care.
Yeah.
Care of the mouth is you treat the teeth and also you treat the gums.
Okay.
So I can confidently say that orthodontic treatment ably falls under dental care because you are forcing the teeth to get into an alignment for the patient to be able to chew properly, to improve their self-esteem, to take away pain, and also to improve the smells, even making your teeth very easy.
Yeah.
Because when the teeth are crooked, as they say, crooked or crooked or not in the alignment, it becomes a challenge.
Okay, so you said most of the causes that come with the poor teeth alignment, some of them are not by choice.
Most of them are not.
Most of them are not by choice.
Most of them are not.
Okay, so why do you think this orthodontic treatment is becoming more common nowadays?
I think there's increased awareness that something can be done about it.
Okay.
People who came before us in this country trivialized many of these things. It was not a big issue. But as we develop, as the country develops, people get exposed, they get to know that something can be done. You can find someone has got issues of self-esteem.
Yeah, of course.
They can't smile, they can't express themselves because the conscious there is telling them, please keep your lips together. Those teeth are not in a straight line. You don't look very good.
You can't laugh.
And it does not only affect the way they chew or appear, it's affecting the whole personality.
Yeah, of course.
Persona. She can't take on certain jobs. She can't express themselves well. So it's becoming a major concern because when you look at a human being and you need to support them, it has to be a holistic approach.
Okay.
So we can no longer downplay some of these things, especially when we know that something can be done.
Okay.
Yeah.
Okay, so what are some of the common dental alignment problems people experience nowadays?
Of course, the first one is there are many.
Okay, yeah, sure.
And some may not exactly have specific names per se, but I want to give you a scenario where people who remove baby teeth quite early, before their due time, create a crisis. Because these teeth come in the mouth in an anodary manner. You'll find that the molars, permanent molars, come into the mouth at the time when permanent molars come into the mouth at the time before the premolars and canines.
Yes.
So when those teeth come into the mouth, they close the space where the canines are supposed to be.
Okay.
So if you find yourself that this child lost their baby molar early enough, that space can easily close, and by the time the canine comes, the space is closed.
The space is not there.
So that's why you find people who have got canines that are, first of all, they take long to move from up down, or when they come, they seem like they're out of the line. So that is one of the scenario.
Okay.
Removing baby molars early creates a crisis of space.
Okay.
If you've not visited your dentist and they've done what they call put space maintainers or space retainers, the teeth will close that space, and by the time the true owner comes in the mouth, it's a bit too late.
Okay.
The other one we've talked about is thumb thucking.
Yeah, sure.
The other one is crowded teeth. Crowded teeth or crooked teeth. Teeth that come and there are too many. They
Does that happen like when someone has more teeth more than the normal?
It appears, by the way, there are cases where you have more than 32 teeth,
Okay.
but when you have a small jaw, you create an impression to the someone seeing you that you have more than
More
what you are
than-
supposed to have.
Yeah.
But the whole issue is a small jaw. So, and in such cases, when we are correcting the teeth, of course, we may have to remove first premolars to create space to be able to pull these ones back
Okay.
into the mouth.
Okay.
Then other habits like thumb stacking.
Yeah.
You know, ordinarily the tongue should sit in the lower jaw,
Down.
down.
Yeah.
But some tongue suckers, the tongue sits in the upper jaw.
jaw, yes.
And when it sits there, it pushes the front teeth unknowingly.
Okay.
So those kind of habits can affect the alignment of your teeth without knowing.
Yeah.
And even when you opt to give your orthodontic treatment, you need to be very intentional about breaking the habit.
Okay.
Because the treatment may not necessarily yield the results you expect because you did not break the habit.
Okay.
So that is key. What are some of the other cases?
I think there are many. We
Yeah.
cannot mention
Yeah, yeah,
everything.
yeah.
But okay, so another question comes: is orthodontics only in children and teenagers, or it goes far
Orthodontic
beyond?
treatment,
Mm.
anyone can benefit from orthodontic treatment.
Okay.
But why children and teenagers is because, and normally dentists will speak about the age 12 or around there.
Okay.
The impression, the reason is, the assumption is the baby teeth by that time have all gone out of the mouth,
Okay.
so that you can
At
now
the age of 12.
at the age of 12,
Yes.
all the baby teeth have gone out of the mouth, and the jaw probably has expanded to a reasonable level.
Okay.
So when you come to forcefully move teeth, this orthodontic treatment is forcefully moving teeth
Okay.
to align in a certain
certain-
way.
Okay.
So it is critical that we wait for the baby teeth completely to get out of the mouth and work with the permanent teeth to make them move in the desired position.
Okay.
So, and because at that age the bone is still soft, you get quicker, faster results around that age.
Okay.
But even me or you or someone older can choose to put on orthodontic treatment. You get the same results, but it may take a little longer because
Okay,
your
because
bone is
Hard.
has solidified
Okay.
and it is stronger.
Are there old people like at age of 70, 80 who still do orthodontic treatment?
I've not seen any,
Okay.
and I want to imagine that probably at that age they've decided what's this fancy thing. But I know that there are people who are in 50s, 60s who still do it,
Okay.
which is okay, because I think why would someone do it at that age? One, it improves someone's confidence. Two, self-actualization. Why not?
Okay.
Why not? I mean, I've gotten the money, I've done everything, there's this solution. Why don't I go for it?
There is no effect.
Yeah, there's no effect. And these days there's something called clear aligners that is even making things easier because no one will know what you are doing.
What exactly is that? Maybe explain
Very
it a bit
interesting
more.
kind of things we give you that you just put
Done.
into your teeth
Okay.
and the teeth will move.
Are you for real?
Yes.
Without putting the.
Without putting brackets, and you can never know that someone has got clear aligners.
Okay.
The only disadvantage that the success of that treatment entirely depends on you because they are removable.
Okay.
It's you to put them in for at least 22 hours a day. So if you fail on that, then you are not receiving results. But I know that people who make that decision, they are normally very committed people.
Okay.
They'll do it. So don't give up on yourself. It's possible.
Okay. So also, how do the crooked teeth affect chewing and speech?
God decided that these teeth, I'm sorry I didn't come with a model.
Okay.
So some of the demonstration of these things, I don't know whether it will really come out. That the upper jaw must meet the lower jaw in a certain way to hold the teeth in between those two sets. And then when you chew, you move your teeth in a certain manner to make that the food soft to be able to swallow. But because of the developmental abnormalities, sometimes the teeth don't touch as they ought
to touch.
But survival must happen. Someone must eat that food. So he will use all the muscles around the jaw to try and bring these teeth that are not exactly aligned the way they are supposed to be able to hold that food, chew it, and swallow. So that one will cause a lot of pain in the head and the neck, because we are just forcefully moving the teeth into, the word is apposition, to meet like this, to be able to chew. If originally they are looking the other side and you need to eat, you are forcing them here. So that's why it was very critical. Those who went before us never highlighted some things, but now we know better, and especially when we understand that something can be done about it. That's why we are going for this kind of treatment. Yeah.
So apart from that, also are there other complications, dental complications that can cause issues like later in life? Apart from that one, when the person cannot chew very well because the teeth is not aligned to meet.
There are also the other situation where we use orthodontic treatment. If you lost one of your tooth, even if they are properly aligned, and you take some time without making a replacement, teeth will move. There's always a tendency to try and close that space. If it's in this linear line, if it's from the opposing jaw, there's always a tendency to grow longer to close there. So if you walk up one day and you say, you know what, enough is enough, I have my money, I need to put a permanent tooth here, you may not be able to do it. You may then need orthodontic treatment to pull back the teeth
apart and
to create that space for you to put
the teeth.
If it's still possible. Sometimes it may warrant removing the upper and also and put implants. Now I'm speaking the language implant, that you need to secure that space. Those are some of the other situations where you need orthodontic treatment to be able to guarantee that space. The other scenarios are sometimes the teeth come in the mouth and they fail to reach the same biting level. Even those ones, there's a way we can hook them into the wires and the brackets and pull them down to come into the right biting state.
Okay, so also many people think braces are only for beauty. Is that a misconception?
Which
need
people?
to address that.
Which people? The teenagers.
Yes, of course.
Of course, the teenagers.
And some parents, they think like taking
it's a status quo. Interesting. Now, many of the things we are doing here, or our level of exposure, comes from the Western world. And some people don't even think or try to understand the why it's being done there. We just copy it.
Of course.
But of course, you know that talking about teenagers and what it comes with, peer pressure, that's also another component. But the real thing are the ties, those rubber things that change color, which we can change every time you go. The dentist can choose to change. For the child, it's like cool. You see,
cool people do that.
Cool people do that. But for the parent, not so many parents, unless those who really could go and agree to do that kind of thing, because orthodontic treatment is not cheap treatment. Of
course, it's not cheap at all.
It's not treatment. It's not cheap. But if the family have got the money, they can go for it. But the real thing are the different colors of the ties that are changed every day, that someone will feel cool That this time I went, they put red. When I go back, I want yellow. Then I want clear. And then, but those are peer pressure things. But anyway, if the resources are there, we can always give you if you want.
Okay.
Yeah.
So what are some of the signs that someone may need orthodontic treatment?
The biggest reason is self-esteem.
Okay.
When you see someone is shying away, they can't express themselves. Even I had a child who needed orthodontic treatment, and I knew what needed to be done, and I kept postponing it. But one day I started, every time I would look at her, I would just see this, the canines came later and they were up.
Okay.
Every time I would look at this child, I'm like, my God, what's this? I'm taking too long. We need to get started on this now. Even this is a dentist child. You know, it became real pressure on my part.
Okay, yeah.
I knew the cost implication, and for ethical reasons, of course, it's not me who did it. I took her to another dentist, orthodontist, who did it. We had to walk the journey and go through everything. But when that anxiety starts coming concerning self-esteem, you will do something about it.
Okay.
Leave alone other obvious issues like chronic headache and those neck pains which come because of misaligned jaws and someone forcing themselves to eat, but it is largely because of self-esteem.
Okay.
Yeah. And also because you want to replace a tooth that was lost so many years ago, and now the space closed and you need to close it up. And the other reason that I didn't talk about is diastema. Do you know that diastema?
Okay.
The gap between your teeth.
Kazigo.
Kazigo.
That's why people call it.
Yeah, in the central here, it's a beauty sign.
Yeah, of course.
But sometimes in the West, Mubazungu, it is an abnormal sign.
Okay.
But also the kazigo looks beautiful if it's a sudden width. But sometimes the kazigo is as the space is as wide as the tooth itself. Have you looked at people like that?
Of course.
And of course, with time, it also starts really going. It is beautiful if it's like this. When you get issues of gum disease and everything, and as we age, it even moves further apart. So you can use orthodontic treatment to close that diastema a bit so that it looks reasonable. Yeah.
Okay, so to go further, at what age should someone receive this type of treatment?
16, 14, as soon as the baby teeth are out of the mouth.
Okay.
That is the best age.
Okay, how about like assessment, like after?
Afterward, the other thing you need to know about orthodontic treatment, after we remove those brackets, or even after you finish treatment with the clear aligners, we always recommend a retainer.
Okay.
Because, you know, we've forcefully moved teeth, they've agreed, but where they came from, the bone has not yet filled. So what we are saying, we need to hold these teeth where they've reached for some time, as we allow the bone to fill the space they came from. Because if you don't do that, when you remove your orthodontic treatment brackets, the teeth go back.
Okay.
So it is very, very critical to have retainers.
It can go back.
Yes.
And yet, oh my God.
They can go back. Yeah.
That's also not a good. Why? What makes it like to go back if at all it has been treated?
And you know, there's a. You see these teeth? Let me give you something. How can I move it? I don't know how to demonstrate. But if the teeth are like this,
yes.
And you want to close this space, you see that space. You move this one. You move this one, you move this one, you move this one. But here I've created a void because there's no tooth. You have to wait for this space, the bone to grow. So that you maintain this position. Otherwise, before the bone grows to fill this space, when I take out my brackets, the teeth will do this.
Oh, okay.
Now you've understood.
Yes, I've understood very well.
Yeah.
So you've talked about the retainers. Are that clear thing you said? Are there other options available today besides that and versus the ones people know?
Yeah. The braces people know this. And the clear aligners. There are two sets. Although in the braces, we have these days something called ceramic the brackets look white or same color as the tooth,
Okay.
and the other ones that are the different, the stainless steel type, the black ones.
Okay.
So that's the difference. So you can always choose from those two. But the other modality is that clear aligner thing, which you just put into the mouth, remove when you are going to eat, put it back, and it's changed every after 2 weeks.
Okay.
And your graduation to the next level will depend on how well you've been using the first set. Yeah, but that one can only be used in specific cases. Simpler, more complicated cases really need brackets.
Okay.
Because that way it's fixed permanently. You don't have to disturb it every time, and that lax of saying, today I'll not put on, I'll not put off.
Yes.
That is a disadvantage of using clear aligners.
Okay.
So complicated cases of orthodontic treatment, brackets are recommended.
Okay. Okay, so how long does this treatment usually take?
It also depends on the individual case
Okay.
and how complex.
It is.
Yeah, but it's not a kind of treatment you say that I came here and next week it's finished.
No, because we see people having the brackets for like 2 years.
Yes.
It
Yes.
can take a long period of time.
You must prepare psychologically. The patient and the person who is a caretaker must prepare psychologically and be supportive on that journey, because sometimes how long it takes for you to accomplish treatment also depends on compliance. I mean, if every time you come back and you've lost, the brackets are off, that means you're not progressing.
Okay.
Because the treatment works in unison. Yeah. So you need to prepare the child, you need to prepare the parents. Sometimes the parents bring their children in for care when they are not ready.
Yes,
Yeah,
of
I've heard of a scenario where the child just, every time they leave the dentist place, they put all the effort to remove the brackets. Until I told her, you know what, give the child time, talk about this thing. Otherwise, it will not work, because we need help.
Okay.
Yeah.
So also, how important is oral health during this treatment?
Very, 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 very important.
Okay.
When you start orthodontic treatment, a few things in your life are going to change. You may not necessarily be at liberty to eat everything you want the way you want. Life changes.
Okay.
For example, you are no longer able to bite into something with your front teeth, or you are eating a mango and you're like,
Okay.
that one will be not recommended. We normally recommend use a knife and fork, chop small pieces with your knife and fork, and put in the molar area.
Okay.
And you chew. And hard stuff or rough stuff, sugar canes, hard corn, and things in that category, we discourage.
Okay.
The intention is you don't want to do anything to disturb, to make the brackets fall off.
Okay.
Because every time that bracket falls off, you are reversing in progressing of treatment.
Yes.
Yeah.
Okay.
So we need, that's why I said that the patient must be prepared psychologically and ready to walk the journey, because their input or cooperation is everything we need.
Okay.
Yeah.
So from your experience, what is the most common orthodontic problem you normally come to see?
The most common one, wow, they are common but not so pronounced, is situations where the children's baby molars were removed early. That's common. And also the canines taking so long to erupt into the line or occlusion here. It's a common one. You see many children who have got canines that are still up here. You need to help them move down.
Okay.
Yeah.
Okay, thank you very much, Doctor. Also, is there any myth you would like to correct today about orthodontics?
Orthodontics. Wow, that's a good one. Of course, it has been perceived largely, especially by youth, by status quo symbol, that if you have braces, you look cool.
For cool people.
Yes, for cool people. And then eventually, when you put them on for especially boarding-going students, they get so used to them that because it's their gate pass. For some schools, for some schools, it's the one guaranteed way of going back home.
Because you have to go for
because you have to go for adjustments. And Yeah, those are some of the common ones. But the message I want to put out there for people to know that there is something that can be done,
Okay.
however complex your case may be. And in this country, we have people who have only studied that.
Okay.
So all complex cases can be handled.
Okay.
Yes, most dentists can handle orthodontic treatment to a certain level, but we have experts in that line.
Okay.
Yeah.
Okay, thank you very much, Doctor. So as we are winding up, please send greetings to 1 or 2 people that have been watching, and then we can call it a day.
Okay. I want to send greetings to Coach Hannah. I know she's somewhere watching.
Okay.
For some reason that we managed to pull it off, and all the other family and friends who are watching this. We are living in the era of being intentional about acquiring knowledge. We never stop learning.
Yeah,
Today
sure.
we are talking about orthodontic care. Tomorrow we shall discuss another topic. Kindly keep watching this station for more information, because one thing for sure, when you stop learning, you die.
Of course.
So let's be intentional of acquiring as much knowledge as possible, and also make sure life is worth living by all means. Thank you.
Okay, thank you very much, Doctor. And to our dear viewers, we've seen that a healthy smile is not about appearance. It's about comfort and confidence, and also the long-term oral health. So early detection and proper orthodontic care can make a lifelong difference. So thank you for tuning in, and this has been your health show. Let's meet again tomorrow from 4 to 5. See you then.